Hello, this is Andrea Mahoney, and I'm going to share with you the evaluation I performed on the effects of infant massage on the attachment between mothers and their infants for my therapeutic effectiveness presentation. So to give you a quick overview of the objectives of this study, it was conducted to examine the effect of infant massage on attachment between moms and their newborns, mostly because psychological development in infants, especially during the first year, is so critical. And so this study wanted to aim to prove that benefit. So the methods that they used, it was carried out from June of 2008 to February of 2010. And there were a total of 57 mothers that were included in the inclusion criteria for the experimental group and 60 mothers in the control group. Between the dates of the studies, all healthy primipara mothers and their healthy infants were included. And data was collected regarding their demographic characteristics using a tool that is called the Maternal Attachment Inventory, which I'll talk about a little bit later. All the mothers that were in this study were assessed on the first and the last days during their 38-day study period. And in the experimental group, the babies received a 15-minute massage. This therapy was done every day during all 38 days. Regarding results, there were no significant differences found in the pre-test mean values in the baselines of the maternal attachment inventory scores in either group, but the post-test mean values of this tool showed that the experimental group mothers were significantly higher than those of the control group, and there was actually a significant difference between them. And so they came to the conclusion that the results of the study showed that infant massage is in fact effective in increasing the mother and infant attachment. So with regard to the study design, this was a quasi-experimental design that was performed with a total of 120 moms initially included and 117 mothers who completed the study. There were 60 participants initially assigned to the experimental group, but 3 were excluded due to incorrect massage techniques. So a total of 57 participants were included in the analysis. And a total of 60 participants were included in the analysis for the control group as well. So before the investigation was started, a power analysis was used to decide the number of participants that would be included for the sampling. In the case of 50 moms each group, they wanted to achieve a medium effect size of 95% interval, and so it was calculated that the investigation would be at least a 0.8 for the t-test. They did understand that some mothers may leave the investigation during this study, so that is why they took 60 mothers into each the experimental and control groups. Between the dates of this study, informed consent was obtained and a non-probability convenient sampling method was used to assign the moms to either the experimental group or control groups. So they did use sampling criteria that included the following. The moms needed to reside in Erzurum City Center and they needed to at least have had secondary school education. They were not able to have any conditions that would prevent them from applying massage. And they were also required to not have any sight or hearing deficits so that their education would not be affected. They needed to be open to communication and cooperation, and they were asked to not participate if they had previously been trained in infant massage, so not to skew the sample. They needed to be primipara as well as breastfeeding, and their infants needed to weigh between 2,600 and 4,000 grams at birth, and they also needed to be between 38 to 42 weeks gestation with APGAR scores of greater than 7 to be included in the criteria. So with regard to the results, the mothers in each group were comparable in age, education, and gender of the babies, and the mothers did not display any differences in demographic variables. There were no significant differences that were found between the two groups with regards to the type of medications that they received. And here in Table 2, it shows the pre-test and post-test total mean values for the experimental and control groups, and this was the information that was obtained from the maternal attachment inventory. There were no significant differences between the two groups for the pre-test total mean scores, as I mentioned earlier. However, the maternal attachment inventory post-test means for the experimental group, the ones that were applying the massage to their babies, were significantly higher than the mean value of the control groups, and the difference between the groups was found to be statistically significant. Average delta change was calculated between the pre-test and post-test after the procedural total means value for the maternal attachment inventory tool and for the massage and control groups. So here in Table 2, the comparison of the mean delta change between the massage and control groups is given and shows a significant difference between those delta changes for the two groups. So reflecting on whether or not this therapy is useful in early detection, Gordis actually defines early detection as detecting a disease at an earlier stage than would usually occur in clinical practice. These infants having no clinical complaints, no clinical symptoms, and therefore not actually seeking any medical care, it's not really quite possible to know how many disease elements are being prevented using this therapeutic intervention. However, this therapy would be denoted as primary prevention and does yield many benefits for these infants. During the first year of the infant's life, the psychological development and the sense of basic trust is being formed. And that psychological development is so critical during that first year. The attachment theory is a very fundamental process that states that in order to improve the psychological development and establish the baby's relationship with the outside world, there needs to be a bonding with a figure. Usually that is with the mother or father, and in this case, breastfeeding, performing skin to skin, and performing infant massage is how that is completed. There is an emotional and expected condition between the mom and baby that begins right initially at the first days of life, because the maternal attachment actually starts during pregnancy and continues right through delivery. It's a unique, a very tender, loving relationship that develops between the mom and the baby, and it leads to the development of trust in the baby as a result that will last a lifetime through this child's adulthood. So in this study, sensitivity and specificity is not explicitly discussed. The study is unable to demonstrate a benefit from early detection of diseases. However, it is able to predict long-term benefits to the infants regarding massage. The following table actually demonstrates the comparison of the demographics and infant characteristics in both of the experimental and control groups. The data analysis was conducted using the statistical package for social sciences, and the descriptive properties of the demographic characteristics are given as percentiles and means, and you can see that here to the left. The chi-square test and one-way analysis of variance tests were used for the comparisons in control groups, as well as a paired sample t-test was used to compare the intergroup measures, and an independent paired sample t-test was used to compare the intergroup measures with the differences between the two groups regarding their pre-test and post-test mean values. And the confidence intervals were 95%, with a p-value less than 5 considered statistically significant. And again, regarding false positive and false negatives, this study did not specifically discuss that. However, the postpartum attachment and care is explicitly discussed, indicating that moms have an important role as the primary caregiver. And when that is taken away, then there is obviously a negative impact in the child's life. So reinforcing that attachment between the mother and the infant yields very positive results. It is very important for the baby to lead a physical, spiritual, and emotional healthy life. And if the relationship between the mom and the baby is inadequate, then the baby is going to have severe developmental and psychological problems that can require long-term follow-up, and you just never know what's going to happen down the road in their adult life. So there are no false positive or false negatives with the data tool used. Therefore, the outcomes are not variable with respect to the impact. So the emotional and physical benefits to the child are almost infinite with regards to how they can be positively impacted from maternal attachment, because a healthy attachment is so important in the determination of the baby's character and habits as they grow into their adulthood. The first touch really strengthens the attachment behavior and is important during that newborn infancy period for perceiving their environment, as well as for the development of the psychosocial realm to be positive. Massage is one of the easiest and most natural ways for a mom to establish a sense of touch and to maintain eye contact to really bond with that infant. And additionally, it gives confidence to her breastfeeding. they found that during skin-to-skin contact between the mom, the infant's health is improved, the breastfeeding is improved, and their crying episodes actually decrease. The infant's sleep duration increases when the moms that spend more time and apply therapy longer to their infant. And one study actually showed that when massage is applied for greater than 6 months, that their mental motor development is improved. They also found that a statistically significant results for the infants who receive massage with regards to the weight gain and their mental motor development. And when we look at maternal attachment, we need to look at two very important factors, which are the interaction between the mom and her baby and the sensual contact between them. And infant massage is just truly one of the simplest, most easy ways for the mom to communicate and bond and really reinforce that attachment with her newborn and establish that contact. With regards to financial resources, there were none discussed or affected in this study. So when we look at the outcome measures of this study, we can conclude that the outcomes were specific and measurable. Before development of the maternal attachment inventory tool, maternal affectionate attachment was most frequently completed using just strictly observation, and they looked at the rates and the patterns of the maternal attachment behaviors. It was all done through observation. And since observational measures are very time-consuming and difficult to apply in a clinical setting and can oftentimes be quite biased, those were not used in this study. We just simply looked at outcome measures. The MAI is actually a tool that was designed to measure maternal affection attachment, and it uses a 4-point Likert type scale. It's a dimensional scale with items that vary between almost always and almost never, with each point having a very direct statement that the mom can record. The higher the score that's obtained from this means the higher the maternal attachment is, and the lower score that might be obtained from the inventory means it might be a less maternal attachment. So the lowest score in this study was a 26, with the highest score being a 104, and the validity and reliability of the studies performed in this proved to be beneficial. So again, just to reinforce how we can't explicitly conclude that disease progression is stopped or reduced with this therapy. However, we can say that encouraging the use of massage will provide an important contribution to a healthy infant overall. The effects of the infant massage on maternal attachment levels in the moms of these healthy infants and the weight gain of the preterm infants was investigated and proved to be beneficial. With the moms and their babies who were born premature or had defects of illness, they had more risk of a detachment and deprivation, and therefore this really reinforced that ability to bond and communicate with their infant. And one thing that was pointed out is that nurses should really include infant massage among the routines of the mom and baby care for both healthy and ill infants. It shouldn't just be completed for healthy infants. Because facilitating infant massage and that, again, mother-infant attachment should be included in the training. And I know that we're not always given that as neonatal nurses, but to provide counseling to the moms with this regard would actually be beneficial long-term for both the educational purposes for the nurse to provide good, healthy, reinforced education, and for the mom to make sure that she is completing the therapy correctly. So one thing that was actually looked at with regard to, can this be applied to all infants? There's actually families in Eastern Anatolia that have many children, and where they live, there is a region specifically that avoids touching their infant. They do not perform sensual contact with their infants at all. They cite the cold weather conditions, socioeconomic reasons, and the fact that they swaddle their babies, and they say that that's fine, that's enough. And so there's no real research regarding the effects of massage on the mother-infant attachment until this study was conducted. And they really wanted to determine the applicability of the infant massage in these families and figure out that level of maternal attachment if it proved to be beneficial. So they did deduce that neurodevelopmental benefits are strongest in the earlier years, suggesting that infancy is optimal time for promoting the bonding and development of the child. They're not specific racial differences, but there can be cultural attributes to be cognizant of. And likewise with gender, it is definitely necessary to remain culturally competent, ensure that there are no insensitivities demonstrated by the staff during education. So those are just things to be aware of. So when we look at a benefit versus a risk, absolutely, there really is no risk involved with infant massage as long as it's being performed correctly. So education is really the most important component. The benefits are enormous, and it truly just strengthens that mother-baby attachment. And a lot of moms don't know that they can communicate with their infant by touch, and they need to be instructed on the methods they can use regarding the tactile, visual, and auditory contact. Regarding cost, yeah, baby massage is simple, it's cheap, it's effective. There's really no reason why it cannot be performed. Again, making sure that we are giving proper education. So infant massage is both practical and feasible to perform. With regard to morbidity and mortality, massage actually regulates the baby's sleep, their respiration, their urinary output, and it decreases colic and stress. So the massage affects the mother's infant interaction in a very positive way, promoting that infant's health. And again, to just reinforce the skin-to-skin contact between them during this early period affects their health status as well. So it can be deduced that there would be a decreased morbidity and mortality rate if we saw this technique being practiced more often. So when we ask if something existing could get comparable results, looking at previous research, there were 23 research studies that were selected and looked at, and it is found that there were 13 evaluation research tools that can be used to identify the mom and child attachment. 7 of them are scales, 3 are questionnaires, and 2 are inventories, and 1 is just strictly observation. The prenatal attachment inventory presents a higher validity and reliability measure to assess mom-infant relationship during pregnancy. However, that's the best tool for pregnancy. And so this maternal attachment inventory is actually the best tool that can be used currently. And it's a very practical measure of maternal affectionate attachment, and it has definitely demonstrated evidence of validity through significant correlations and other indicators of maternal attachment. Here are the references I used. Thank you so much for listening.